In this video, we are going to talk about what you can expect if you have an injury at the C7 or C8 level. The learning objectives are listed above. We will identify activities that you may need assistance with, as well as equipment that might be helpful for you, and also build an understanding of what level of function you can expect for a C7 to C8 injury. With a C7 injury, you will be able to move your shoulders, bend at your elbows and wrists, and have some ability to move your fingers. With a C8 injury, you'll be able to complete those movements, as well as likely being able to grasp and release objects in your hand. You will also be able to speak, breathe, and chew independently. You can also advocate for yourself and direct your own care, and will be able to use a power or specialized manual wheelchair. With a C8 injury, you might also be able to manage a bowel and bladder schedule and program independently. With a C7 injury, you might still require some assistance with the bowel and bladder management. At both levels, you will still not be able to feel or move your trunk or lower body. When you leave the hospital, you can still expect to use adaptive equipment to help with bathing, dressing, and eating, and like we mentioned, might also require use of adaptive equipment for a bowel and bladder management program. You may need assistance with transferring from place to place depending on height and surface, and you might need assistance getting to the toilet as well. Some equipment you might use at home could be a slide board when transferring to an elevated surface such as a car. Also a power wheelchair or a specialized manual wheelchair for community mobility and moving around your home. This piece of equipment is known as a universal cuff. It will wrap around toothbrushes, hairbrushes, eating utensils, and anything else that you would like to hold in your hand. And as pictured on the left, you would loop your hand around the other side. So if you have weaker grip strength or a hard time holding onto objects, then this would work well for you. With the C8 injury, you might not need this. So work with your therapy team on what pieces of equipment are best for you. This is another piece of equipment called a plate guard. It goes along the outer edges of the plate so that when you're scooping or loading food onto a utensil, you can use that border to help get the food onto whatever utensil you're using. This piece of equipment is used for toileting, so that blue bucket on the left here can slide under the hole of the chair, and this can be placed next to a bed if you're unable to get all the way to the toilet. And then once you're done using the bathroom, that bucket can just be dumped out. Another use for this is putting the chair over top of a toilet so that you don't have to sit on such a low surface, and it'll make the toilet taller. And there's also handles on both sides in case your core strength is a little bit weaker. There's also a piece of equipment that sits on top of the toilet and is just called an elevated toilet seat, shown here, which also comes with handles on the side. Something that might potentially benefit you would be installing grab bars in the bathroom. This can be in multiple places, as they show on the side by the toilet, up higher if you would like to use that to help with momentum in standing up or having someone assist you, and you can also place them in the shower. You can expect to be working with several different kinds of therapy. Goals that you'll be working on in therapy include things like strategies to ensure frequent and proper pressure relief and prevent skin breakdown. You'll also be able to work on directing your own self-care and management of a bowel and bladder schedule. You can educate family and caregivers about how you would like to be assisted with your daily care. We'll work on strategies to help feed, dress, and groom yourself. If appropriate, you'll receive slide board training to move from one surface to another. We'll likely achieve independence with bed mobility and rolling side to side in bed. And we'll also help you learn how to use either a power wheelchair or specialized manual wheelchair to help with getting around your home and getting out into the community. And that will wrap up what we believe you need to know when you have a C7 or C8 spinal cord injury.